Time is brain. Since stroke thrombolysis has become more available to acute care, the emphasis placed on the role of the out-of-hours registrar has been intensified. Guidelines locally and nationally agreed suggested that the door-to-needle time, the time that the patient arrives until the bolus of TPA is administered, is 60 minutes. Locally agreed arrangements with the emergency department, medicine, nursing and radiology have minimised delay in team working where possible. However, a commonly identified issue within thrombolysis meetings is that logistic and communication missteps encourage delay. This short instructional vodcast is in place to act as a walkthrough for out-of-hours stroke thrombolysis in Craigavon Area Hospital. When a lysis call goes out, the medical registrar should attend as soon as is safe the site identified by the call, usually A&E Resus. Out of hours, you will be supported by either a trained nurse from 2 South Stroke or the hospital at night coordinator. They will carry equipment required for assessment and bolus preparation and administration.
Mrs. Smith, Jerry Sloan's my name. I'm one of the doctors here. Nice to meet you. I want to just do a brief assessment to see how you're getting on in terms of some weakness that's been reported today, okay? Can I ask, have you any pain anywhere?
No pain.
No problem. Do you know where you are at the moment?
Yeah, Craigavon Hospital.
Fantastic.
Make a focused assessment by taking a time of onset history and using NIHSS to ascertain if lysis is an option. This should ideally take no longer than 5 minutes. Consider obvious contraindications like oral anticoagulation, recent surgery, etc. Assess the patient's blood pressure and sugar.
Switchboard here on 0. Hello. Hi there. Can you put me through to the duty radiologist on call, please? Hello. Is that the radiologist on call for Craigavon? Hi, my name's Jerry. I'm one of the registrars on call this evening.
Call the radiologist on call via switchboard. Dial 0. It should be communicated that the CT is for thrombolysis. Then contact the CD radiographer in the same way via switchboard.
Hello. Hi there. It's Jerry Sloan here, one of the stroke registrars. I have a patient, Mrs. Olive Smith, who is a candidate for thrombolysis.
At this point, do not forget to order the CT scan via Sectra.
I need to order the scan on Sectra.
Call the consultant to inform them of the patient and their age, time of onset of symptoms, NIHSS score, premorbid state of the patient. The consultant needs only these details to prepare for decision making. Observe these 2 examples of an effective and an ineffective call.
I need to speak to the consultant on call. Hi there. You wouldn't put me through to the consultant on for thrombolysis, please? Thank you very much. Hello, is that Dr. McCormick? Hello, it's Jerry here, one of the registrars. I have a lady here who has attended this evening who is a candidate for thrombolysis, 50-year-old lady, no past medical history, NIH score of 4, weakness on the right hand side, no obvious contraindications at this stage. We're going for CT now. That's great. Thank you very much. Hi, yeah, it's Jerry here, one of the regis on call. You would put me through to the stroke doctor, please? Yeah, on for lysis. Thanks very much. Hello, is that the doctor on for stroke thrombolysis? Dr. McCormick, hi, I'm Jerry Sloan. I'm one of the doctors on this evening. How are you? Hiya. I tell you what it is. I have a lady here who has come into A&E with some weakness. I would grade it about 2 out of 5 power. Wee bit vague, I suppose, in terms of how that came about, but I think timing wise it's probably okay. She said she felt a bit clumsy in the hand around about 1 o'clock or so. Yeah. I'm not too sure about blood pressure and sugar at the moment, but I'll find those things out. There should be a scan happening soon. Okay. Thank you.
Assist the transfer to CT. If weight can be obtained by the nurse during the phone calls, it should be. Failing this, consider an estimate. The bolus of the drug should be drawn up while the image is being taken. Contact the stroke consultant again once the image sequence begins.
Hello, Dr. McCormick, it's Jerry Sloan here. Just to let you know that CT's been completed. We're going up to 2 South Stroke now. Thank you.
Assist the transfer to the 2 South lysis bed. From here, consent for the drug should be obtained using the information sheets available in the lysis pack. Review the contraindication sheet in the lysis book.
Mrs. Smith, that scan's been completed. We can't see anything on it, but the clinical scenario, for the way your arm and leg became weak at 1 o'clock, is suggested that this is a small stroke. Okay? Because of the time of the onset of this, and because we can't see anything on the scan, the likelihood is it's a small blood clot has caused this.
Consider reassessment to ensure no great evolution in symptoms and blood pressure is satisfactory. The CT result should be confirmed either on Sectra or via phone call to the radiologist on call. If there is a delay, call the stroke consultant to assist. Administer the bolus after double checking with the nurse and the ready reckoner in the lysis booklet. Record times of the bolus, CT scan and calls where possible. This pathway is time critical and therefore can be stressful. However, remember, the consultant and nurse are there to support the assessment from the beginning. Events are as follows. Assess onset time. NIH-SS score. Call CT and consultant. Assist to CT. Liaise with consultant again. Lysis consent and administration. We hope this vodcast is helpful. This is not in place to teach how to carry out an assessment, but how to follow a pattern of events that minimises logistic delay. Thank you for your attention.